Good afternoon. Thank you for joining us. Thank you. Thank you for joining us in the Senate Finance Committee. Today is Tuesday, March 12th. We have 6 bill hearings today. It's a light day. We're going to start with Senate Bill 790 and then Senate Bill 944, 888, 1016, 876, and 994. The sponsor gets as much time as they need. All the witnesses have 2 minutes. Please respect that time. Senator Klassmeyer, you're going to start with Bill 790 if you'd like to go to the witness table.
Would you like to call my panel up?
I will call your panel up. Josh Bassel, Katie Fava, Janice Jackson, and Chiffon Gray. You can come up to the table. You might short a chair. Yeah. If there's not a seat for everybody, we'll wait and have you come after the first few people.
To the right of me. Can you always right to the right? You might need to take that first. Let's take it.
You want to go
Bring that over here. Katie's gonna sit next to me.
There's a mic.
I'm gonna go over just a little bit more. Sure. The baby needs to get in there.
If there's not enough room, we can come up after the first panel speaks. So if it's a little
I
tight,
think there's enough room, but yeah.
you think,
You're in?
I see a stroller coming up behind.
Bring that over. Thank you.
Everybody settled over there?
Thank you so much.
Okay. Senate Bill 790, Maryland Medical Assistance Program, employed individuals with disabilities. Thank you, Chair Bidle and fellow members of the fantastic Senate Finance Committee for the opportunity to present Senate Bill 790. This legislation will provide opportunities and predictability for a full life for our residents who are very disabled and face more challenges than most of us can ever imagine. This bill adjusts the financial eligibility for those in the employed individual with disabilities EID program in a way to remove the financial and service penalty for marriage and age. The EID program is administered by the Maryland Department of Health, MDH, and is a Medicaid buy-in program for individuals with disabilities who are currently working and would not be eligible for Medicaid due to income. It covers medical services for those who do not have any other insurance or can supplement services for a private insurer does not cover. Those who have Medicare as part of their Social Security Supplemental Security Income, SSI, can save as much as $12,000 a year in premium as a part of EID. This program is a great resource for those residents, and they depend on the services they receive for help with their activities of daily living to thrive and participate in their communities. The Department of Health deserves great credit for having made recent improvements of the EID program, including eliminating the income limit, no longer counting spouses' assets, and allowing participants to save money in independence accounts that don't count against the asset limit. However, under current policies, participants lose their services when they turn 65, even if they are still working. In addition to that, premiums may become too expensive to afford if a participant gets married. In all, Senate Bill 790 has three major components: First, the bill will codify the recent changes MDH has made to the program involving income and asset limitations. Second, the bill removes the upper age limit of 65 for the program. And third, the bill will prevent MDH from counting a spouse's income when calculating EID premiums. These changes will help ensure that the individuals in this program can continue living their lives to the fullest as long as possible. Removing the upper age limit will give those 65 years and older the opportunity to continue working, paying taxes, and supporting their communities. The current age limit would force people like Janice Jackson, a 64-year-old quadriplegic who will be testifying today on my sponsor panel, into nursing homes at a large cost to the state. The next part of the bill aims to prevent workers from being penalized for getting married. Some unmarried applicants who are currently paying EID premiums of $55 per month or less could be forced to pay hundreds of dollars per month if they're married, which is what happened to Josh Basil, who many of you already have met over the years, and he is on my sponsor panel. In some situation, an applicant could even have to pay $1,000 per month. In my conversations with MDH, I have appreciated their willingness to work on the issues regarding the marriage penalty and aging out at 65. I am grateful for their recognition of the problem and their willingness to work on the solution. However, we are still here asking for support of Senate Bill 790 to ensure that our most vulnerable residents are not left behind. In my time as senator, it has been my privilege to work alongside many courageous advocates such as those beside me who have significant disabilities and contribute to the society. Please listen to their stories with an open mind. Thank you, and I ask for your favorable report.
Josh, would you like to go next?
Yes. Thank you. Yeah. Let's try this. Thank you, everyone. Esteemed members of the Finance Committee, my name is Josh Basil, and I wheel before you urging the passage of SB 790. At the age of 18, a beach accident left me paralyzed below my shoulders, but it did not break my spirit. I returned to school. I went on to graduate from undergrad and law school with honors. After passing the bar and becoming employed, I enrolled in the EID program, Employed Individuals with Disabilities, in order to maintain my Medicaid. This program is vital to accessing long-term care supports like attendant care and nursing care. Since then, I've faced challenges to the strict EID rules limiting earnings and savings and punitive measures around marriage. Progress has been made. As of January 1, 2024, a state plan amendment went into effect, removing income limits and creating independence accounts for savings. SB 790 represents an opportunity to further dismantle existing barriers, especially for those wishing to marry and those who turn 65. My love story began in 2019 on a Match.com date. I quickly fell in love with Katie and her beautiful daughter, Fable. They welcomed me into their lives and loved me unconditionally for all of my abilities. After getting engaged to Katie, she underwent IVF, and in 2022, we welcomed our precious son, Calder, into the world. Unfortunately, those in the EID program who are married are punished by rules requiring spousal income within the monthly EID premium calculations. If Katie and I were to marry, my monthly premium would immediately jump from $55 per month to $500 per month, and Katie would not receive any benefit from this program. A total of 22 other states do not have income for spouses within their premiums. I do support the policy. The more I earn as an EID recipient, my premium should increase. SB 790 is more than good public policy. It's about love, family, the right to pursue work without constraints. I urge you to issue a favorable report on SB 990 or 790.
Thank you to the entire family. It was. Thank you. Josh, it's nice to see you again. Katie, do you want to go next?
Yes. Yes.
Do I wait for the timer? Okay. My name's Katie Fava. Josh and I have been engaged since 2020, unable to get married due to the limitations imposed by current legislation. But I'm not here today to speak to you as Josh's fiance. I'm here to speak to you as Fable's mother. You see, my beautiful daughter Fable has two dads, a fully able-bodied biological one that has failed her repeatedly and no longer has physical or legal rights. And this man seated before you, who has fully embraced fatherhood since day one. He was actually excited to meet a divorced single mom because he was unsure if he would be able to have biological children. Spoiler, he could. This man who prioritizes his children over all else has found ways to play, to teach, to work, and to comfort them. With him, my children are safe, loved, and provided. Nothing in this world is more important to me than my children, which is why I have a deep fear that if heaven forbid anything were to happen to me, Fable would be stripped of the father that has raised her and protected her, because without this bill, he has no pathway to securing rights to her. There are so many implications tied to this bill that impact the safety and security of families with disabilities. This one implication is my personal why. By passing this bill, you open the doorway for Josh and I to get married, which in turn allows him to legally adopt his daughter, Fable. It allows him to provide her safety and protection and love no matter what happens to me. It allows her to stay in the same home as her little brother. Separating her from the only family she knows would be traumatic, dangerous, and life-altering. This bill at its core is about sustaining families. Fable's story is just one story, but it is an example of the broad sweeping inequities that are present for individuals with disabilities. Today, you have the power to use your vote to change lives in the most impactful way possible. For Fable and all the children who have a parent with a disability, please vote yes. Thank you.
Thank you, Katie. Who wants to go next?
I'll go next.
Thank you.
Good afternoon, Chair, Vice Chair, and members of the committee. My name is Janice Jackson, and I am a resident of Baltimore City. I support Senate Bill 790. I have taken this position because in 9 months, my life will take a very devastating turn unless Senate Bill 790 is passed. In 1984, at the age of 24, I was hit by a car. 1 minute, a very successful woman, and the next minute, a woman with a disability. My number one goal after having a disability was to re-enter the working community, and the EID program made that possible. I am very successful in the community as a professor at the University of Baltimore, where I've been working for over 23 years. Without this bill, my life definitely will have a different outcome. You see, under this bill, if not passed, I will be a victim of discrimination under the face of ageism. When I turned 65 this December, under the current rule for the EID program, I would lose my EID eligibility and the Medicaid it provides. I would not qualify for community-based Medicaid in any other way. Medicaid is the only form of health insurance that covers the intensive attended care services I need to survive and to live and work in my community. I also have Medicare, but Medicare does not cover these services. There is one other way that I would qualify, but to get it, I would have to enter a nursing home. I can't imagine the outcome if this bill doesn't pass. Please vote for the EID program. Thank you.
Thank you. And our last witness?
Siobhan?
Yes.
Good day, Chair and committee. My name is Chiffon Gray. I'm from Baltimore, Maryland. I am a blind individual and I also work with the Image Center of Maryland. And I am 100% for the 790 bill, and I encourage and urge you all to really pass this bill, because without that bill, I would not be working for the Image Center. Without that bill, I wouldn't be able to have medical treatment that I do have now, not just because I'm a blind individual, but I have other medical disabilities as well. And I literally just turned 65, so we know that just knocks me right out of the park, so to speak. And people with disabilities, especially the blind, they really want to work. And they will work for a very long time. They're very loyal to their employers. And if this bill doesn't pass, well, I'm going to be up a tree, so to speak, because I certainly can't pay 20% of my medical costs right now. It would be horrific and traumatic. And so I just urge you to pass this bill and go beyond the age of 65, because I enjoy my job and I don't want to have to make the choice between healthcare or job. Thank you so much.
Thank you. Do I have any questions from our senators for this panel or our sponsor? I see no questions. Thank you very much for your testimony. That ends the bill hearing for Senate Bill 790. No, I'm sorry. There's three more people.
I just want to, can I give a quick shout out? We've got so many people that came so far to be here with us today in the audience. It's this bill impacts so many families, and for them to be here today, to wheel here today, to get public transport, like it takes a lot to get here, and the support that we have behind us, it's a testament of how many people this bill impacts.
We could have people either stand or raise their hands, whatever they're comfortable with, to show support. Thank you. Thank you. Gosh, thanks for doing that. I appreciate it. I do have Matt Rice and Audrey Sellers in favor that can come up.
Thank you, Madam Chair, members of the Senate Finance Committee. My name is Matt Rice. I am the Executive Director of People on the Go Maryland, Maryland statewide self-advocacy organization ran for and by those with intellectual and/or developmental disabilities. SB 790 is a no-brainer because it is ultimately the intersection between public policy and morality. And very rarely do we see those things intertwine. But for my members and for myself, we need this bill. I use the EID program to maintain waiver supports and services. And eventually, no time soon, but eventually I will turn 65. And I want to be able to work. I do not want to be forced into retirement. Nobody should be forced into retirement or in a nursing home. Nobody should be penalized for wanting to be married and be loved by someone. These things should be fundamental rights. I also come before you as a brother to somebody who is on the autism spectrum. I want my brother to know and understand the dignity of work as I have come to understand it. Senate Bill 790 will help him do that. So please vote yes. Thank you for my time today.
Thank you, Matt. And Audrey?
Good afternoon, Madam Chair and members of the Finance Committee. I'm Audrey Sellers, advocate with Disability Rights Maryland, which is the protection and advocacy system tasked with advancing the rights of Marylanders with disabilities. We're here today to convey our complete support for this bill. Please allow me to tell you a little bit about my experience with the Employed Individuals with Disabilities Program, as I myself am an EID recipient. I have a form of muscular dystrophy that's been present since birth. Despite my disability, I've been working continuously since I was 14. When I learned of EID, I was amazed that such a great program existed. I'm fortunate to have coverage through EID, and my life would not be the same without it. However, major improvements can be made to better the recipient experience, especially through the application process. For example, it took over 8 months for me to be approved for EID. During these 8 months, I endured high monthly costs for prescriptions, out of pocket, paying over $600 a month. Ultimately, these costs were covered under reimbursement, but they were a hardship as I waited for EID approval. The changes that this bill would make to the application process would streamline the process and make it more user-friendly, shortening wait times. Crucially, also for me, this bill eliminates the marriage penalty. My partner and I have been together for 4 years, and we would like to get married. Without this bill, moving forward in our relationship by making that sacred commitment is simply financially unfeasible. EID is a lifeline for working Marylanders with disabilities. I hope you will issue a favorable report on this bill.
Thank you, Audrey. Do I have any questions for this panel? I see no questions. Thank you for your testimony. And finally, we have Deputy Director Ryan Moran, or Deputy Secretary Ryan Moran from the MDH for favorable with amendment.
Chair Beidle, Vice Chair, members of the committee. For the record, Ryan Moran, Deputy Secretary of Healthcare Financing and the state's Medicaid Director. First of all, I want to extend my deepest and sincere gratitude to Josh and to Janice, who we have been meeting closely with, particularly over the course of the past few months, but really over the course of the last couple of years, the departments have been in conversations to make much needed improvements and expansions to the EID program. I want to note that the bill of 790 specifically takes 5 expansions, of which currently there are about 1,000 individuals who are eligible or enrolled in the EID program. And these 5 provisions that the department implemented in our state plan on January the 1st of 2024 expanded the program by nearly double, so up to 2,200 participants. Those 5 things are: we lowered the eligibility age from 18 to 16. We eliminated the income requirement and disregarded all retirement accounts for participants. We created flexibility for independent accounts. We disregarded spousal income and assets as part of applicant eligibility, and we set new premium levels for higher income recipients. I also want to make note that in conversations with the Senator's office and advocates, that we are strongly in a position to work with them as part of the bill's provision of 2 required meetings per year. We've set up the first meeting on May the 6th to address the 2 additional expansions of which you've heard from the most today. The first is removing the age cap, and the second is looking at spousal income being removed from the premium. There's a few things that the department in partnership with stakeholders want to do. One, we want to look at understanding the fiscal impact, monitoring other state models, and thinking about equity considerations in terms of these provisions within our other Medicaid programs. And with that, Chair, thank you so much. I'm happy to take any questions, and we urge support with amendments on Senate Bill 790.
Vice Chair Clausen.
Say, Ryan, thank you for working with everyone on this, and I appreciate, if you could keep us abreast when you have your meeting. And what'd you say, May?
May the 6th.
May 6th.
Yes.
And please, do whatever you can, especially for the working people here that want to keep working but can't. So that 65, I'd be up the creek myself. As Miss Williams said, up a tree. I'd rather go up a creek, but that's okay. But if you, whatever the department can do, these folks need help. And I'm hoping as time goes on, it might not happen overnight, but let's just take it step by step and just get it done. So thank you very much.
That is our commitment to look at all those
Thank
issues,
you.
Vice
Yeah.
Chair.
Thank you for that commitment.
Do I have any other questions? Senator Washington.
Thank you, Madam Chair. You mentioned the amendments that you had, that you were going to propose. Have you proposed those amendments yet, or has anyone submitted them yet?
So we have provided those to the senator's office as well as on the House side, and we have been in conversations with the stakeholders on what those amendments are. Yes.
Okay, thank you.
Do I have any other questions? Thank you for being here. We
Thank you all
appreciate
so
your
much.
work on this issue. Thank
Yep.
you, Ryan. That ends the hearing for Senate Bill 790. Next, we have Senate Bill 944. If Senator Kelly's here, there she is. Senator Kelly, come on up. You have Elizabeth Crum and Robin Elliott with you, I think.
Yes, ma'am. Sorry, let's get
give
started as
folks-
they
yeah,
come up.
let's just give folks a little bit
Okay.
of time to exit. Thank you all for being here. Go get your picture taken or something. You did.
Oh, we need some chairs. We'll just get some chairs together.
Senator Kelly, thank you for your patience. I think it's quieted now.
No, absolutely.
Thank
Thank
you.
you so much. And thank you all for being here to consider Senate Bill 944, which is a short and somewhat simple bill, although it may be confusing when you read it. So I will do my best to explain it very quickly and then have Robin Elliott and also Elizabeth Crum, who's here from the Health Department, answer any of your technical questions. This legislation actually came up as we were working on last year's piece of legislation that dealt with making sure we had access to emergency contraception on our four-year colleges. As we were doing that, we came across some barriers that are in place to access to contraception. So we wanted to remove some barriers and update some language. Basically, the legislation codifies the existing practice in terms of the formulary of over-the-counter medication and devices that our nurses can give out in local health departments. So that's one part of the bill. What we want to do is just make sure that in the health departments, nurses can hand out over-the-counter medication or devices in the same way that anyone else who works in a local health department can already do that. There's just a little bit of confusion as to whether nurses, because of language in the Nurse Practice Act, can do that. So if you're not a nurse, you can hand out over-the-counter medication or devices such as condoms. But if you're a nurse, we need some clarification in the law to make sure they can do that. There's another section of the bill, though, that deals with criminal penalties, and you'll see there's an amendment from the Department of Health, which we're supportive of. And there is also a second amendment that the House subcommittee just put on the bill that I will hopefully will address any questions or concerns you have about the criminal penalties section. We wanted to, there's a kind of old language that has criminal penalties for having condoms in vending machines. There are two sections of it. One section deals with distribution in schools, and the other section deals with non-latex condoms. The section about the distribution in schools was removed by the House subcommittee. So we're going to suggest that this committee consider conforming with that, because that's just not a conversation I think that people are ready to have right now. The intention was, of course, not to have contraception available in our elementary schools, but it can look like that from what you're reading. So we don't want to go there right now. But what we do want to make sure is that, and this relates to the Department of Health amendment, sorry to be so technical here, but there are new advances in condom technology that we want to make sure are included in our vending machines. So the Department of Health can address that. So pretty simple bill. With those amendments, it allows us to have vending machines with appropriate condoms in them, but not in the schools. And it allows our nurses who work in local health departments to distribute any over-the-counter contraception. So with that, I will pass it off to Robin Elliott, and I urge a favorable report with those amendments.
Good afternoon, Robin Elliott. I'm here on behalf of the Maryland Nurses Association, the American College of Nurse Midwives, and the Women's Law Center of Maryland. Just wanted to raise two background pieces of information. The first is that Maryland is the only state with a criminal penalty for sale of any type of condom in a vending machine. And I discovered that because I was a lucky person who had a research project to review all 50 state vending machine laws. It was terribly boring, but luckily during COVID. The second piece I wanted just to raise is that there is a new form of over-the-counter birth control called Opal. It's going to be available on the shelves this week. And also part of the impetus of this bill is just to make sure that nurses and local health departments are able to provide this contraception without fear of discipline in the Nurse Practice Act. The Nurse Practice Act currently prohibits nurses in local health departments from giving out any over-the-counter medication or device. And with that, I would ask for a favorable report with the amendments that the sponsor suggested.
Good afternoon, Madam Chair, members of the committee. I'm Elizabeth Crom with the Maryland Department of Health. We're in support of this bill with one small amendment, and you actually outlined it very nicely, so you've done my job for me. Everything that you've heard so far, I was just going to echo. I do just want to point out that having this making condoms available in public health vending machines not only reduces barriers to access, but it's very much in line with our state's condom distribution strategy, which is required by the Centers for Disease Control and Prevention as a part of our comprehensive HIV prevention strategy. So our amendment is that we're looking to prohibit the sale of condoms with natural membranes in these vending machines. So this type of condom just basically has been proven to be not effective in reducing the transmission of sexually transmitted infections. So there are many other products out there, and including those for individuals with latex allergies that are proven effective and safe. So we just want to make sure that that particular type of condom is not provided in a vending machine. And so we submit this amendment respectfully and really thank you for your time and consideration of this bill.
So my counsel tells me we have one of the amendments.
Yes, ma'am. The second amendment was just adopted on the House side in subcommittee, so we will make sure you have that as soon as possible.
Thank you, Senator. Thank you for this bill. Do I have any questions for this panel? I see no questions. Thank you very much. We have one additional person favorable with amendment. It's Diana Young.
Good afternoon, Chair Vital and the esteemed members of the Finance Committee. Thank you for the opportunity to provide testimony today. I am Diane Young. I am a registered nurse and the Associate Director for the Family Health Services Division with the Prince George's County Health Department. I'm here to express the county's support for Senate Bill 944 with the expressed amendments for today. The legislation is essential in dismantling outdated barriers and enhancing the role of our public health nurses, directly addressing pressing public health concerns, especially the sharp rise in congenital syphilis. The bill facilitates broader contraception access through vending machines, which we support, a measure that is crucial not just for prevention, but as a tool for our broader strategy against the resurgence of syphilis. The CDC just reported that in 2022, 3,700 babies were born with syphilis. And of those babies, 231 were stillbirths and 51 later died. 100% of these deaths were preventable. By allowing non-prescription contraceptive access in vending machines and empowering public health nurses to distribute non-prescription contraceptives, we expand the capacity to offer preventive care and reduce barriers to essential public health services. Public health nurses are trusted in the community, and we need to be empowered to address these issues, particularly in underserved communities. Senate Bill 944 represents a forward-thinking approach to public health, aligning with our goals and MDH to curb the rise in sexually transmitted infections and to reduce the number of unplanned pregnancies in the state. It embodies our commitment to innovation, accessibility, and informed public health strategies. Thank you, Chair.
Diana, thank you. And thank you for your work in public health. You sound out favorable with amendment.
as produced today.
The amendments that were already. Okay.
Yes, ma'am.
I just want to make sure if we needed any additional amendments. Thank you very much.
Thank
Do
you.
I have any questions for Diana Kelly? Thank you very much.
Thank you.
Senator Charles come in. Do I have anybody else? Did I miss anybody? No. Senator Charles, we're going to take you next. Senator Hayes is kind enough to let you go ahead of him. So
Thank you.
thank you.
That's perfect because we have a voting session that's going to be starting at JPR. I think some of your bills are in there. We can get them out, Alonzo. All right, good afternoon, Chair Biodo, Vice Chair, and honorable members of the Finance Committee. For the record, I am Senator Nick Charles testifying in support of 1016. This bill has been heavily amended and comes before you in a different posture than how it was first dropped. Senate Bill 1016 lays the foundation to prioritize the health and safety of our children above all else. In the state of Maryland, we face a pressing issue that demands our attention, which is the accessibility of medications for children subject to custody agreements and visitation schedules. We must recognize that medicine is not just about treating illness, but it's about preserving lives. From asthma inhalers to allergy medications, these are vital tools that ensure that our children can breathe, move, or live without fear of debilitating symptoms or life-threatening reactions. In the context of custody agreements, the responsibility of managing medications fall upon both custodial parents. However, as I've heard from parents and constituents, disputes over access to prescriptions can escalate into larger conflicts where the well-being of the children becomes secondary to the power struggles between adults. Some parents may wield the power of prescription access as a means to exert control or manipulate custody agreements. It's a distressing reality where custody agreements are not honored and medicine is used as a means to restrict access to overnight stays and visitation for the parent that lacks access to the child's prescription. Now, some may argue that calling the police should suffice in resolving such disputes, but let's pause and consider this implications. Involving law enforcement and domestic disputes can be traumatic for children. It disrupts their sense of security and stability, creating lasting emotional scars. Moreover, sometimes the failure to send along a prescription may not be an act of control, but a simple oversight. Having a prescription in both homes where a child may be staying is a necessity. This is precisely why the implementation of Senate Bill 1016 allows pharmacists to prescribe separate medications for each custodial parent is not just beneficial, but imperative. It's about safeguarding the health and well-being of our children, regardless of the dynamics of parental relationships or a mistake in packing the child's belongings. It has been submitted an unfavorable testimony that involving pharmacists and prescribing separate medication for each custodial parent could create administrative hurdles or logistical challenges. But let me speak to you about this. Should bureaucratic convenience be prioritized over the lives of our children? Also, we have submitted an additional amendment that creates a clause that shields the pharmacist from penalties or fines during a desk audit for providing additional prescriptions. And two, it ensures that companies and the insurance companies and pharmacy benefit managers cannot deny the additional claim and must approve any separate supply for both parents under this bill. We have reached out to all who have submitted unfavorable testimony to share our finalized and requested amendment to this bill and appreciate their communication as we have reached to a comprehensive solution. I must also note that as amended, this bill would not double the supply of any drug. It will simply split the prescription based on the amount of time the child spends at each parent's house. Therefore, it does not create a new circulation of more medicine in our society. In Maryland, we have a duty to prioritize the needs of our children. We must ensure that the pharmacists have the authority and the flexibility to prescribe separate medications for each custodial parent, therefore ensuring a child never goes without their prescription and safeguarding the health and safety of our children. Senate Bill 1016 does just that, and I urge a favorable report. Thank you.
Thank you, Senator Charles. Do I have any questions? Senator Klausmeyer?
Yeah, hi, Senator. Just got here, so I didn't get to look at the bill, but with the prescription drugs, say you need some amoxicillin, okay? would you go to the same pharmacy and just ask the pharmacist to split it? Is that how that would work?
Well, it all depends, because some parents may live in Virginia, or some parents may live in DC, or, you have children living in different jurisdictions, and so they may have a pharmacy that's closer to their house. So they'll be able to go to that particular prescription instead of when the doctor prescribes the medicine. For instance, let's say it's pills, so that makes it a little easier to deal with, and they give you a 30-day supply of some particular pills. If the child is going to be with one parent for 6 days of that month, then the prescriber will get 6 pills, and the rest of the pills will go to the other parent. So when they go to the pharmacist, they'll be able to get their prescription for 6 pills for the child, so that they have that readily available for the child when they come to their house.
Okay. All right, but I'm just trying to think of the logistics. It's got to be hard when you go that distance from each other, but I guess that if the bill passes, you'll figure it out. Right? I don't know if you will, but whoever you're doing the bill for will.
Yeah, they'll figure it out. I hope so, at least.
No, I mean, and I understand exactly what you're talking about, because we all split our time from home to here, and I am minus 3 pills this week. They're at home, so.
Listen, but that's
I
a real
appreciate
reality.
it.
though.
It's the reality. Thank you.
Thank you, Senator.
Thank you, man.
We have 2 unfavorables. You don't want to sit at the same table. Elia Horton and Sarah Price.
Good afternoon. My name is Aaliyah Horton. I'm the Executive Director of the Maryland Pharmacists Association. We are opposed to the bill as introduced. And we have had conversations with the senator about a number of issues, and we did submit written testimony. As we've gone kind of back and forth about the bill, obviously our members are of utmost importance is medication adherence for all patients. Some of the concerns we have are operational and logistical, and we've tried to bring the concerns that our members have thought would come up immediately, but have since realized that we really need engagement from the insurers and the PBMs, because that's a big part of it. Whether the medications will be covered, whether pharmacists will get a dispensing fee for all the times that they dispense. We don't know clearly, as this committee knows, how the PBMs operate, because it's not exactly transparent. And we want to make sure that those issues, all of the issues, are resolved to make it a smooth process for pharmacists to be able to dispense with the intent of what the bill is looking for. One of the other issues that just recently came up after conversations with the senator was also with what's called unit of use. And so that would be with inhalers, with insulin and other medications that are, the prescription is one piece. The other part is with controlled substances and reporting to PDMP, what that would look like in terms of red flags, the double dispensing of any of those. So there's just a lot of questions. We want to figure it out. But I think we need some more partners to help do that. So I'll leave it at that. Thank you.
Good afternoon, Madam Chair and honorable committee members. My name is Sarah Price, here on behalf of the Maryland Association of Chain Drug Stores. Our concerns are largely the same as the Pharmacists Association. Ultimately, our position would likely depend on exactly what the amendments look like. If it is simply a true double prescription, then we completely agree. We would need a lot more buy-in, I would say, from the insurers to make sure that that would actually work logistically. We did have some concerns, or if the bill would require
that insurers do cover both prescriptions. We would want to make sure that that happens as smoothly as possible for the families. We all know that if you're going on vacation, you can call in and say, hey, I have a reason that I need to pick this up ahead of time, but you have to call in every time. So we would want to make sure that that would not be the case for these families, that this would be sort of a blanket approval and that they wouldn't have to jump through their own hoops to make sure that they can get that every single time. So with that, it's a great goal. We love what you're trying to do, but we do think it needs a little bit more work. Thank you.
Thank you very much. And you both brought up very good points. So thank you for your testimony. Do I have any questions for this panel? Senator Hayes.
Thank you, Madam Chair. Ms. Horton, in your testimony, you described the fact that you guys need the cooperation of the insurers. I know the insurers spend an awful lot of time here, so does the PBM, but none of them have testified on this bill or the amendments. Do you have an hypothesis on why they may not have weighed in? Have you all been in contact with insurers that have brought you to the conclusion that there may be some operational obstacles?
I do, but I prefer that they answer that question. I
Got
prefer
it.
not to speak on their behalf.
So you all have been in contact with them. They just chose
Yeah.
not to be here today. Gotcha. Thank you, Madam Chair.
Any other questions for this panel? I don't see any. Thank you both for your testimony. Thank you, Senator, for your bill. That ends the hearing on Senate Bill 1016. Senator Hayes, are you ready to do Senate Bill 888? And you have Felicia Porter.
Good morning, good afternoon. Look at that. Good morning. We've been on the floor way too long for me to still think it's morning time, right? Good afternoon, Madam Chair, Madam Vice Chair, members of Senate Finance, Senator Antonio Hayes, representing the 40th Legislative District in Baltimore City. For the record, I'm here today with my colleague in Baltimore City Government, City Councilwoman Felicia Porter, to testify on behalf of Senate Bill 888. Senate Bill 888 would authorize local behavioral health authorities to hire their own inspectors to monitor the quality and safety of behavioral health programs. This bill represents a crucial steps towards ensuring the well-being of individuals receiving behavioral health services in our communities. One of the most significant aspects of Senate Bill 888 is the provisions for LBHAs to employ inspectors dedicated to overseeing behavioral health programs. These inspectors, in addition to any employed by the Maryland Department of Health, will play a vital role in ensuring the behavioral health facilities adhere to the highest standards of care. By having inspectors specifically focus on behavioral health, we can better address the unique challenges and complexities present in these settings. Furthermore, Senate Bill 888 mandates that LBHAs track complaints against behavioral health programs and forward relevant information to the Appropriate Health Occupations Board. The accountability measure ensures any concerns of grievance raised by individuals receiving care or families are promptly addressed, contributing to improved transparency and responsiveness to behavioral health system. Additionally, the requirement for behavioral health programs to seek community input when forming agreements with LBHAs underscores the importance of involving stakeholders in decision-making processes. Community involvement fosters collaboration and ensure that needs and perspectives of those served by behavioral health programs are adequately considered. The provision allowing the BHA to adopt regulations to implement the bill further strengthens its effectiveness. Clear guidelines and standards set forth by BHA will help streamline the implementation process and provide clarity of LBHAs and behavioral health programs alike. Finally, the requirement for BHA to report annually to the General Assembly on implementation, Senate Bill 888 demonstrates a commitment to accountability and ongoing evaluation of its impact. These reports will enable legislators to assess the effectiveness of the bill's provisions and make informed decisions about future policies and resource allocation and around of behavioral health. In conclusion, Senate Bill 888 represents a significant opportunity to enhance quality and safety of behavioral health services in our state. Madam Chair and colleagues, we all understand how important it is to have behavioral health services available to our citizens here in Maryland. I had a chance to read the testimony that was provided by the Maryland Department of Health. But I remind the committee just a couple of days ago, weeks ago, it's all running together now in these 90 days. Senator Feldman, my seatmate, Senator Kramer had a bill whereas we were requested to give local authority to our local health departments. Baltimore City being the oldest health department in the country has built up pretty significant capacity here in the state of Maryland and is a willing participant in this activity. I believe that this piece of legislation give yet another extension of what's already being provided from our state health agency on the ground. And looking at the testimony, there's two, the department submitted testimony with favorable with two amendments. One of those amendments would essentially make sure that those employees remain local employees and not the employees of the BHA. The other amendment requests that there be some clarifying comments around the community involvement. Obviously, that's kind of the crux of the bill. We probably would need a little bit more time to communicate with the department to come up with some type of compromise provision should this bill advance and make sure that those amendments address all of the issues here today. So with that, Madam Chair, colleagues, I will end my testimony and urge a favorable report for Senate Bill 888.
Thank you. Councilwoman Porter.
Thank you. For the record, I'm Councilwoman Felicia Porter representing South Baltimore in Baltimore City. Dear Chair, Vital, and honorable members of the committee, I'm writing in support of Senate 888, Local Behavioral Health Authorities and Oversights of Behavioral Health Programs. Behavioral health plays a critical role in the overall vitality of the communities that I serve. Behavioral health encompassing mental, emotional well-being influences our ability to navigate life's challenges, maintain positive relationships, and contribute meaningfully in our society. To address and support the diverse needs of our community members, we must recognize the indispensable role played by behavioral health facilities. Yet, as a public health scientist, I believe that it is equally important that we think critically about the quality of the mental health services that are available to our residents. As we strive to invest in our communities that promote the well-being of all its members, it is essential to recognize the pivotal role that oversight plays in ensuring the delivery of high-quality services and outcomes. The major issue within the current landscape of behavioral and mental health facilities is the lack of consistent oversight of secondary quality of life issues that impact the community. From a regulatory standpoint, while clinics are following the law, the current provisions have led to a variation in service quality and accountability. Reports of substandard practices and inconsistent intervention strategies underscore the need for a unified approach to safeguard the interests of individuals with substance use disorder. From a community perspective, rather than focusing on long-term recovery, mental health clinics serve as a continuous invitation to people who do not live in these communities and have become a breeding ground for crime, drug use, and drug exchange. With over 20 mental health clinics in South Baltimore, the oversaturation have left residents skeptical of their utility of their community and the trust within the Maryland Department of Health. Senate Bill 888 stands to address the need for stronger enforcement mechanisms on behalf of the local behavioral health authority and calls for increased community input in decision-making. This bill also highlights that by implementing rigorous standards and monitoring protocols, such oversight mechanisms will help prevent the adverse events and protect some of our most vulnerable populations. The recommendations outlined in Senate Bill 888 align with the goals of the community and move towards an equitable oversight and flexibility for all of Baltimore. I ask you for a favorable vote with amendments for Senate Bill 888.
Thank you. Do I have any questions for this panel? Senator, do you want to wait while we have, I think I have a virtual.
By the way, Madam Chair, as you look, I know that your bill butts right up against the city. Councilwoman represents that council district that is adjoining to your legislative district as well.
Good.
Yeah.
Like, nice to see you.
Yeah.
No, the Jolie Dietz is virtual and she's just information only.
Okay.
So, do
Excellent.
you have any questions at all for this panel? None. Thank
Thank you so very
much.
much.
Thank you. Julie Dietz. Dees, if you can hear me, please put your camera on and unmute. I think we've lost Julie, so that'll end the hearing of Senate Bill 888. Thank you. Our next bill is Senator Alonzo Washington, one of our committee members with Maryland Medical Assistance Program, Senate Bill 876. Would you like to bring up your panel, or would you like for me to call them?
Yes, please.
Ann Seacott, Ann Geddes, Ashley Toller, Gail Martin, and Pallavi Arora.
Madam Chair, if I can amend that, instead of Ann Seacott on here, we're gonna ask for Joyce Harrison to come
Okay.
on virtual.
Okay. And she's in, okay.
All right. Hello. Thank you, Madam Chair, members of the committee. Senator Alonzo Washington here to present on Senate Bill 876. Ever since the pandemic and even in some communities before it, we have seen our children struggle more and more with mental health. Countless communities are asking our government to do something regarding the state of our children's behavioral health. And our teachers have been pleading for years for this issue as well. While all this occurs, we have vast state resources in every county that it can only be accessed through a diagnosis, or if someone is above the age of 18. This arrangement creates a constraint for families, as many are too time constrained or financially unable to get a proper diagnosis for their child. On the other hand, the state offers various resources that could make their life much easier of that child, and that could be used without a diagnosis. This bill looks to allow children under the age of 18 to access the state's behavioral health resources, freeing up hundreds of families from the financial and temporal burden of having to set up an appointment to going to said appointment and monitoring the progress of a private serving behavioral space specialist just for a diagnosis. There's no reason to keep these beneficial services under lock and have children who desperately need them to see their mental health deteriorate. Every person can benefit greatly from seeing a counselor, psychiatrist, or other specialists, and thus we must encourage their use as a government. We cannot allow our children's mental health to fall behind, especially with all the resources that our state possesses. We have to empower our parents, children, and specialists to decide what's best for us and better serve our youngest residents. I will just add, Madam Chair, that as you can see from the testimony, almost everybody on here supports it or supports it with amendment, minus MDH and one other person by the name of Vince. I can't remember who that person is. But I would just say, Madam Chair, that this is a great bill. And I did look at the fiscal note of the bill too, that the MDH did not provide how much that this would cost in more services. Students are already able to be able to have the services. All we're asking for is to remove that diagnosis clause that's in there, that requirement that's in there. It's not necessary. Our students need as much help as they possibly can get, and to remove that barrier would unlock so many services for our students that are suffering from behavioral health issues. For those reasons, Madam Chair and members of this great committee, I ask for a favorable report on this bill.
Thank you.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. My name is Pallavi Arora, legislative intern at the Maryland Hospital Association, here to support Senate Bill 876. I'm currently pursuing my master's in public health at Johns Hopkins, but I'm also a trained psychologist. So I'd like to just start by highlighting how diagnosis among children and adolescents can be a really complex and nuanced process. I have faced similar challenges in my work previously with youth as well. And several children may present with behaviors that may not neatly fit into a single diagnosis or alternatively meet several diagnosis criteria. So it seems really unfair, not to mention stigmatizing, to prematurely label a child with a diagnosis that may not accurately capture the entirety of their circumstances and experiences. The presence or absence of a diagnosis should not dictate whether the child can continue receiving the care and support they need and deserve. Additionally, this bill aligns with the hospital field's goals to improve emergency department throughput and wait times. More than 200,000 patients visit Maryland emergency departments seeking behavioral health services each year. As we all know, the behavioral health care crisis in Maryland contributes to ED length of stay and hospital discharge challenges. But this bill will ensure that children can get the critical help they need at the onset of behavioral health conditions and avoid unnecessary utilization of the EDs. I'd like to thank Senator Washington for his leadership on this issue. And for these reasons, we respectfully request a favorable report on Senate Bill 876. Thank you.
Good afternoon. Excuse me, Madam Chair, Madam Vice Chair, and members of the committee. My name is Gail Martin. I am representing NASW Maryland chapter in favor of Senate Bill 876. I'm here today as an individual who, with two other social workers, owned a private practice where we did therapy. Two of the three of us specialized in the treatment of children and teens. Diagnosis, as you heard from in the prior testimony, is very difficult with these kids. Diagnosis is always both art and science, but with children and adolescents, there's a lot more art than science. We can't give x-rays, we can't do blood work. Our diagnostic criteria are often based on what we're told verbally, and children and youth don't have the ability, for example, to say, yes, I've been feeling sad 5 days out of 6 for the past 6 weeks. Treatment of children and adolescents is really much more based on symptoms than on the diagnosis itself. Children can present with irritability, for example, secondary to trauma, secondary to depression, secondary to problems going on in the home between their parents that's causing anxiety. It doesn't really matter what the basis of it is as much as it does helping the child learn how to manage that anxiety and where their irritability and where their responsibility lies there. Despite our best efforts, stigma really continues to be a problem for mental health diagnoses, and these that are made for children follow them into adulthood. Thank you very much for your time. We urge a favorable report for Senate Bill 876.
Thank you. I also called Ann Geddes and Ashley Toller. They didn't come up. Are they not here? Okay.
We're just dividing themselves up.
Okay. And then we'll hear from you, and then we're going to do our virtual witness.
Okay. Hi, thank you. Thank you, Madam Chair and committee members. My name is Ann Geddes. I'm with the Mental Health Association of Maryland here in support of Senate Bill 876. 876 does not prohibit a provider from issuing a diagnosis, and there may be instances where the provision of a diagnosis is helpful and even necessary. But there are some very good reasons to pause before labeling a child with a psychiatric diagnosis. It can be extremely difficult, especially in the case of very young children. It can be unclear if they're experiencing a developmental delay or if parenting challenges are impacting behavior. Often it is only by working with the child and family over time that some clarity emerges. But it is not only very young children that can be hard to diagnose. There are legitimate concerns about the overdiagnosis or misdiagnosis of children and youth. Typical childhood growth involves rapid change, and children go through phases. I have personal experience with this. From the age of 13 to 18, my son was given 5 different psychiatric diagnoses, including bipolar disorder and borderline personality disorder. His psychiatrist said, you're not supposed to diagnose an adolescent with borderline personality disorder, but I'm going to make an exception in your son's case. Turns out that as an adult now and for the last decade, the only diagnosis my son has had has been anxiety disorder. He was experiencing gender dysphoria, which was undiagnosed, and that was the cause of many of his symptoms. Those diagnoses, bipolar disorder and borderline personality disorder, followed him into an adulthood as he sought a top secret security clearance. And then finally, it can be extremely damaging to a child's self-image to be labeled with a psychiatric disorder. A young person can grow up believing that there is something wrong with them and that they are somehow abnormal. Mental health providers should be able to proceed with caution when it comes to rendering a psychiatric diagnosis for a child. Senate Bill 876 would give providers that freedom. For those reasons, we urge a favorable report. Thank you.
You, Ann?
Thank you, Madam Chair. Members of the committee, I'm Ann Seacott with Public Policy Partners. We have a number of clients on that list of supporters, and I'm very happy that NCADD and ASWs you've heard, and Inseparable, who you will hear from, and others are supportive of this bill. I've learned a lot doing the research on this bill, and I've learned that the things that you've just heard, that sometimes it's really difficult to give a child an accurate diagnosis. We have these diagnoses for clinical reasons, of course, but it's the services that are really important in being able to, especially earlier in behavioral problems with children, to be able to address them. It's preventative, and that's the number one thing I think with this bill. In the opposition that you see from the health department, they talk about difficulties because of the carved out system that we have in Maryland. Just understand that the diagnosis is required right now for billing purposes. That's kind of how the system is set up. And there are at least 2 other states that are doing this without those diagnoses. So, and we, frankly, I feel like we are mistaken to be afraid that we're going to open the floodgates for more kids accessing more services. I simply believe that that would kind of be a good problem to have. And I just want to mention also the code issue. I'm looking down at my paper here, Z codes. There's this thing called Z codes that I've learned about that are really based on social determinants of health. And those are ways that if the state would turn on some of those Z codes, we could accomplish some of this. So for those reasons, we ask for your.
Ashley, I think.
Hello, Madam Chair and members of the committee. My name is Ashley Toller, and I am representing Maryland Coalition of Families in support of Senate Bill 876. Maryland Coalition of Families is a statewide nonprofit organization, and last year we served 4,600 families who had a loved one that struggled with behavioral health challenges, and nearly 70% of those families were families with children. Many MCF families are concerned that a premature diagnosis will stick with the child long term. Their child is growing and developing. A mental health diagnosis is unique and complicated for all, but particularly for children. This bill gives our families more time to move forward in a healthy and effective manner for their child. For example, a child had gone into inpatient treatment with a handful of mental health diagnoses. After some time, they decided to assess this child for autism. The child had a history of trauma and indeed tested on the autism spectrum. In conclusion of this child's treatment, it was found that at least 2 of the diagnoses were incorrect. Unfortunately, some of these diagnoses remained on the child's record, leading to frustration for the parent to have to explain and provide documentation to aftercare providers over and over and over again. And also, trauma can sometimes mimic other mental health disorders. This bill will give the provider and the patient necessary time for those who need it. It is also ethical practice to delay a diagnosis as well. And we thank you, and we urge a favorable report on SB 876.
Thank you. And before we have questions, we're going to hear from our virtual panel member, Joyce Harrison.
Thank you so much, Madam Chair and Vice Chair and honorable members of the committee. Many of my predecessors have stolen a lot of my thunder, but I'm really going to focus on my role as I'm here on behalf of the Infant Mental Health Association of Maryland and DC. I am a child psychiatrist, and I'm a rare child psychiatrist in that I specialize in children under the age of 5. Which is a really important thing. There are even fewer of us than there are child psychiatrists in general. But the Infant Mental Health Association, just to make you aware of who we are a not-for-profit, multidisciplinary group of really committed early childhood professionals across disciplines, whose mission is really to ensure optimal development in the youngest and the most vulnerable of our children. We are an affiliate of the World Association for Infant Mental Health, and we're an active chapter. So you've heard from my colleagues very articulately that diagnosis is a process. It's not an end-all be-all. And I loved what you said about it being, sometimes an art more than a science. But what the things I want to focus on are really the accessibility that this bill might result in, and the aspect of prevention and very early intervention, and not necessarily early diagnosis. So only about half of children, and Anne stated it well, this is not going to open the floodgates. Only about half of children who need mental health services even get to them. Diagnosis is a process. It's a balancing act between landing on a diagnosis and coming up with the right treatment. And I support this because on behalf of my association, because it's a step toward acknowledging that infant and early childhood mental health is relational health. The problem doesn't always, and most often does not, reside in the child. And sometimes the problem that resides in the child is not a mental health one, but a developmental trauma, as you've heard very articulately from my colleagues. So on behalf of the Infant Mental Health Association, I'm urging a favorable vote on this bill, Senate Bill 876. Thank you.
Thank you. So now we can have questions for the panel as well as our virtual witness. Senator Klausmeyer?
Yeah, I'm just,
Will you direct me your question?
okay, I guess, Ian Geddes, it does, you all know about the same thing. I'm just a little confused as to who would, if I had a child and they were misbehaving all the time, and you know how you always think, oh, they're kind of crazy and all that for your kids, and the behavior is, and I'm not sure if that's regular behavior or not behavior. How would I know to take my child to a therapist, or what a doctor, what the pediatrician, or?
That was where we got our guidance, but we went to our pediatrician with our concerns, and our pediatrician suggested that we take our son to see a therapist and a psychiatrist. That's often the case. Sometimes the school identifies an issue, but most often people seek help from their pediatrician.
Okay, now, I guess all schools do not have a counselor, I'm sure. We don't, but I guess a teacher could refer to the parent and say, he's acting out in the school or whatever.
Yeah, it was actually the school, the IEP team, who suggested we take our son to the pediatrician, who suggested we take our son to a therapist and a psychiatrist.
Okay. All right, thank you.
Senator Reedy?
So can I follow up on that? Where did the process go wrong then?
That's a great question. And, I think in relation to this bill, it is that requirement to render a diagnosis, and they see a cluster of symptoms, right? In my son's case, he was a severe self-injurer. He really cut himself very badly and burned himself and injured himself in other ways. And he was very depressed, and but those things, so he got these diagnoses of bipolar disorder and borderline personality disorder, had to do with the self-injury and multiple hospitalizations. It was a function of his gender dysphoria, which was never identified and until he was an adult. Once he transitioned to become a man, that the self-injury stopped, the depression stopped. It was just a case of misdiagnosis. But I think, it's hard. It's hard to identify exactly what's going on with the youth. They're all over the place, and they don't know. He didn't know where he was at.
But when you took him, and I'm sorry to interrupt, but I appreciate hearing it. When you took him to get behavioral health services, they won't give him behavioral health services because he didn't have a diagnosis? I'm not understanding.
No, they would give him behavioral health services, but he did need a diagnosis.
Okay, so what, okay.
And that's what this bill seeks to do is remove that requirement.
So he got the diagnosis.
He got 5 diagnoses. Yeah, 5 different diagnoses.
But what's happening? So can I, and I know it was one person, one question, but I'm sure if I would just follow up with the bill sponsor maybe. Or so you're trying to get at though, when kids are as young as 10, 11, 12, what would be the, because we're talking about obviously medical assistance. So you don't want it to just, there has to be some limit on it. So is it my 10-year-old's acting out? I want, like,
Yeah,
where's the dividing
Thank
line?
you, thank you, Senator, for the question. And let me just clarify a little bit about what the bill does. What we're saying is that there shouldn't be a barrier to access these services. For instance, evaluation and treatment planning, family therapy, group therapy, individual therapy for people
that.
under the age of 18.
Okay.
Right now, you need, in order to access these under Medicare, you need a diagnosis, excuse me, thank you. You need a diagnosis. What we want to do is make sure that, because that takes time to receive. It takes a long time, and we know these families need that immediate care sometimes. And so instead of going through that process, we want to make sure that they get it as soon as they possibly can. And there's evaluations that happen before this, and we're just asking not to have a diagnosis for this under this piece of legislation.
So you'd get an evaluation. You wouldn't just be I mean, not that we don't think some families maybe just need to show up and get help, but I mean, there has to be some screening, obviously. So there would be some level of screening, but it just wouldn't be they wouldn't be the full on, your son has whatever disorder or whatever
Correct.
diagnosis.
For that question, because you asked another question, I'm gonna ask Ms. Joyce on there to respond to that one if she can, for that question.
Yeah, I think the point is that sometimes a diagnosis can be prohibitive in getting a certain type of service. And so I think that this would allow for services to be based more on symptom presentation. So I don't think anybody's advocating for anybody who doesn't need behavioral health services to walk into any kind of facility and get those services. But I think what this does is it takes the pressure off the provider to come up with a premature diagnosis in order to access those services. So I think the idea is to increase access to services. Because I will tell you, in the world of young children, I see children where the problem is really in the relationship between the parent and the child, or the child has a significantly ill parent. But in order for me to get that child to services, which have to intricately involve the parent, I have to give that child a diagnosis, which is really very frustrating at times.
Sometimes that leads to problems in the educational world where then they can't do certain things with the child in the educational setting because he has this diagnosis, it's this patchwork. Yeah. Thank you very much. Thank you, Madam Chair. I know we went around the room there, but thank you.
It's a kind of difficult situation to understand. So that ends the virtual panel. I'm sorry, the favorable panel for the senator. Do I have any questions, any other questions for this panel? Thank you all very much. Now we've got 3 more virtuals that are favorable. Liz Park. Liz, are you there? Okay. Thank you. You want to unmute? There you go. Thank you.
Hi, thank you so much for allowing me to testify this afternoon. Liz Park, I'm the co-chair of the Maryland Association of Youth Service Bureaus and the director of Greenbelt Cares Youth and Family Services, part of the city of Greenbelt. I'm here to offer testimony in support of SB 876. Youth Service Bureaus provide prevention and intervention mental health services to youth and their families. We see every day youth who are demonstrating symptoms of anxiety, depression, suicidal ideation, and they need help right away. Having to wait for a diagnosis to offer that support places a barrier to them seeking the services that they need, not only the child, but the family. As youth service bureaus, we always offer support to the family, and the parents need that early intervention as much as the child does. They need the support and to learn the skills, parenting skills, support skills that they can offer their child. This bill will allow children and their families, their parents, their caregivers to access services when symptoms start to appear. They won't have to wait to deteriorate. They won't have to wait to meet criteria. And will allow the intervention to start as early as possible. And we all know that early intervention is so much more successful than waiting for a child to have symptoms to meet the criteria of a diagnosis. So we offer our strong support for SB 876 876, and ask for a favorable report.
Thank you, Caitlin. Do I have any questions for Caitlin? I'm sorry. Oh, I'm sorry. That was Liz. I'm sorry, Liz. Do I have any questions for Liz? Thank you. Now we'll have Caitlin.
Thank you, Madam Chair and members of the committee. My name is Caitlin Hochul, and I'm with Inseparable, a national nonprofit focused on closing the treatment gap for people with mental health needs. I am here today testifying in support of SB 876, which allows children covered by Medicaid to receive basic mental health supports regardless of whether they have a formal diagnosis. We're so grateful to Senator Washington for introducing this bill, which is a smart approach to breaking down the barriers that both clinicians and families face when a formal diagnosis is required in order to provide children the help they need when they need it. As some of the prior panelists mentioned, we know that many children can struggle and experience stress without meeting the criteria for a more formal mental health disorder, and yet they still struggle with mental health nonetheless. For example, they may face difficulties adjusting to a new sibling, experience anxiety, or struggle with the loss of someone close to them. Studies show that early intervention and prevention work, and it's important that kids can readily access mental health services that could prevent a diagnosable condition and the need for more intensive and costly services in the future. Fortunately, several states have begun to recognize this. California and Colorado allow limited Medicaid mental health services for children and youth without a diagnosis. Maryland should do the same. Doing so will not change who is eligible for Medicaid or expand benefits, nor does this bill prevent a provider from making a diagnosis. Instead, it simply eases access to early intervention services that improve outcomes, reduce crises, and minimize costs. This legislation is a timely, transformative step that will support the well-being of children, which is vital to a thriving society. We respectfully urge your favorable report of SB 876. Thank you.
Thank you. Do I have any questions for Caitlin? I see no questions. Thank you for your testimony. Next, we have Samurai Cheney.
Hello, my name is Samira Cheney, actually. Good afternoon, everyone. I'm Samira Cheney, and I am the acting chair of Prince George's County Youth Action Board. I am testifying on behalf of the Youth Action Board team in favor and support with the Senate Bill 876. The Prince George's County Youth Action Board was established in November 2019 to provide an outlet for youth to speak about their experiences with homelessness. The need for quality mental health and substance use care has never been higher. Young people prefer to access mental health care without a diagnosis, both because diagnosis carries stigma and barriers rather than facilitate care. SB 876 can help. As written, the bill's provisions only apply to young people under the age of 18. We recommend that the bill be amended to apply to the young people under the age of 26 and young adults between the ages of 16, a unique population. They are situated at the intersection of childhood and adulthood, a developmental period where their biological and psychological functioning changes rapidly. By intervening during these years, we can improve young people's overall well-being and help them lead meaningful, healthy, and successful lives. This amendment is important for our organization because of the age group we serve, 16 to 26-year-olds, and with the after effects of COVID-19, the need for mental health services for this age group is at an all-time high. Youth and young adults are seeking pathways for positive outlets and opportunities to improve their the growth of the youth we serve will be affected. As stated, the need for behavioral health care is at an all-time high. The coverage for limited behavioral health services without a diagnosis in this bill is needed now more than ever, especially to facilitate access to care for transition age youth. The Prince George's County Youth Action Board urges this committee to pass the SB 876 with amendments for transition age youth. Thank you all for your time in acknowledging my testimony.
Thank you. Do I have any questions for this witness? I see no questions. Thank you for your testimony. And finally, for this bill, we have Ryan Moran, Deputy Secretary for Medicare, unfavorable.
That's right. Hi, Chair. Hi, Vice Chair. Good to see you all again. For the record, Ryan Moran, Deputy Secretary of Healthcare Financing and the state's Medicaid Director. I first want to start very similar to what Ann Seacott said. What a fascinating and interesting piece of legislation. And we also have been working with Ann and the team to dive in terms of some of the other novel, innovative state models that exist here. I'll offer to the committee that California was the first state that brought this forward, that went live and has early 2023. So the department is really interested in thinking about this as a model, and by no means are afraid, if you will, of opening access for early interpreventative services for kids. I also want to note that our letter of opposition really stems around some of the operational way that we finance our healthcare delivery system. So as it's already been mentioned, diagnosis drives payment. And in our delivery systems, the brain is connected to the rest of the body. Unfortunately, our healthcare payment system in this particular state with a carve-out model bifurcates that. So the ability for a diagnosis and the ability for payment in our particular state's model is driven even more by the diagnosis. So there's some opportunities to think through about how our carve-out model of behavioral health administrative service organization, by the way, of which is one of the only few states left in the country with that particular model, and very different than some of the other states that have went forward in terms of that financing, how we actually think about operationalizing this service in the future. As you know, and the committee passed an opportunity in a bill to study the healthcare financing model. And I believe that the commission, as well as the Behavioral Health Administration and Medicaid, has a commitment to taking a look at these particular programs as we take a look at the future of our financing and delivery system as it relates to payment. So with that, I'm happy to take any questions committee members might have.
Senator Washington.
Thank you, Madam Chair, and thanks for taking my call. We met a little bit, at least briefly, about the bill.
Yeah.
Just real fast. So your testimony here and on your written report speaks to your system that you have, and not that you don't. Do you think that we should still have diagnosis? Because you didn't speak to that piece. Should that still be should that still be there? That you need that, or like California, do you just need more time to phase this in? Like, what's the difference?
Yeah, so I want to make a couple of clarifications. One, on the somatic side for primary care health providers, there is up to 3 sessions to assess a diagnosis for a child. And then also on the administrative service organization, that particular 3 sessions is available. So I'm not necessarily saying, or the department's position isn't necessarily opposed to the particular model. It's trying to think about operationalizing it within the confines of our system.
Got it. Thank you.
Do I have any other questions for the Deputy Secretary? I don't see any. Thank you for testifying and for working with our senator.
Thank you.
Ron. That ends the hearing on 876. Next, we have our final bill of the day, which is Senate Bill 994, and the Vice Chair is going to take over.
I'd like to call Senator Benson, who is our sponsor. Laura Nurafosky, David Rodwin, Jasmine Bonamalo, Zoe Gallagher. Is that 6? 1, 2. And Everett Hackett. Okay, that's right. We have Senator Benson there. So then after this panel, then we'll go with the next group. So Everett, you'll come up later. Okay, Senator Benson, you take as long as you'd like.
Okay.
And everyone else gets 2 minutes. Okay, so why don't you explain your bill? Thank you.
Good afternoon to Madam Chair Vital. She probably had a bill hearing in another committee. We're all very busy today. We're very, very busy down here. Vice Chair Klausmeyer, and to this esteemed committee. Before I start with my testimony, I want to just tell you all personally that I have been working tirelessly since 2015 on a bill that's very similar to this. It's probably the same bill with a different title. And I have to tell you all what prompted me to put this piece of legislation in, not only today, but also in 2015. There was a young mother who came to talk with me. She was the mother of 3 children. And she told me about her experience and that she was a single parent. And she talked to me about her struggles, trying to keep a roof over her head and taking care of her children and taking an interest in providing the necessary resources for survival. And then she spoke to me about her job. She said, listen, I have to go to work. I have 3 children, 3 little children. I have to find somebody to take care, or I have someone to take care of my 3 children because I'm a single parent. She said these words, I have to catch a bus, and then I have to transfer to another bus. She said, I catch 2 buses to go to my job. She said, a lot of times when I get there, they've either cut my hours or they tell me they don't have any work for me. So I must turn around and catch the same 2 buses back to my children. She said, I have to pay the people who take care of my 3 children. I have to pay for my bus fare. And she went on and on and on. This was 2015. I made up in my mind. I thought about my own self. I said, my God, there by the grace of God goeth I. I could be born and raised under the same circumstances, but I'm fortunate to be here in Annapolis, Maryland. And so with that, I put a bill in. I have been putting a bill such as this in place since 2015. Now, it took me 10 years to get the seatbelt bill passed, and I'm still working on this bill that's been before this General Assembly since 2015. So I wanted to just provide for you all a little background as to why you keep on seeing this bill. And I am hoping today, after testimony, after you hear from these wonderful people you see seated here at this table, I want to thank them for having the heart and the soul to be here, to share my passion and my concern about the least of these, which, my friends, is one of the main reasons why I'm here, to look out for the homeless, the hopeless, and the helpless. That's my desire. Senate Bill 994 is a legislative proposal aimed at providing predictable schedules and stable working hours for hourly shift workers employed by food, hospitality, and retail establishment with at least 500 employees worldwide. The primary objective of this bill is to provide core protections for hourly workers and deter erratic scheduling. The bill offers covered workers the opportunity for a family work balance by providing 1, 2 weeks notice of shift schedules, 2, compensation when shifts are changed at the last minute, and 3, time between shifts to commute, eat, and rest. The bill guarantees certain rights to hourly workers, such as an employee's written consent for accepting new or additional hours that are not reflected in the original schedules, and an extra hour paid for such hours. Employees also have the right to decline excessive openings and closings, and they should receive 1.5 times the pay for hours worked within 11 hours of a previous schedule ending, previous shift ending. It is noteworthy that the bill does not mandate that an employer guarantee an employee's request for certain shifts, but workers and employers are free to mutually agree in writing to change scheduled hours at any time. The bill will prevent managers from unilaterally implementing unexpected last-minute schedule changes and imposing the need for an employee to successfully close and open the establishment. It is pertinent to mention that 9 other states have already implemented more stringent, predictable scheduling measures than those proposed in this bill. Predictable schedules do not pose an unreasonable demand on the large retailers to whom this bill would apply. Starbucks, my favorite store, has already, my doctor told me not to go into Starbucks. Starbucks has already implemented its predictable scheduling measures in 2014, no more caramel macchiatos, which require managers to post work schedules well in advance and eliminate shutting down practices. If a worldwide chain like Starbucks can adopt such practices using standard scheduling software, other retail franchises should be able to do so as well. This bill would reasonably hold large chain employers accountable to their employees when last-minute shift cancellations occur. It would help reduce stress, which has been increasingly linked to chronic hypertension, lower productivity, and slower business growth. It would also help women as they bear the brunt of caretaking outside the workplace. Requiring predictability in employee schedules and earnings helps the employer by increasing employee stability and decreasing turnover. In conclusion, the Senate Bill 994 is a crucial legislative proposition that aims to provide predictability and stability to hourly shift workers employed by food, hospitality, and retail establishments with at least 500 employees worldwide. This bill offers core protections for hourly employees, which could help reduce job stress and improve employee stability, leading to improved productivity and business growth. Therefore, my wonderful friends, I would like to urge you to give a favorable response to Senate Bill 994. And I do have some attached amendments that I would ask that you all take a look at. So I want to thank you in advance for hearing this melodious voice. And once again, ask for your favorable report.
Thank you, Senator Benson. That was a melodious voice. We always love to hear it. Okay, and is this David?
Yes.
Okay, now we'll just go right on down the line.
And apologies in advance. My voice is not as melodious, but I'll do my
Just
best.
practice, you know.
Yeah.
They'll give you some
In between
practice.
sessions, I'll work on it. Good afternoon, Madam Chair, members of the committee. My name is David Rodwin, and I lead the Workplace Justice Project at the Public Justice Center here in support of SB 994. And we thank Senator Benson for championing fair scheduling and predictable scheduling practices in Maryland, as she said, since 2015. The amendment just aligns the Senate bill with the House bill because of some timing issues. The Senate bill is a little bit longer than the House bill is, but substantively it's merely the same. So the problem this bill addresses is unpredictable and erratic schedules, which have a extremely deleterious effect on Maryland's working families. Workers can't plan their lives and their families' lives when they don't know when they're going to work and they don't know how many hours they're going to work. Has an effect on their ability to provide care for their children and elderly parents in many circumstances. It also, when you don't know how many hours you're going to work and you're living paycheck to paycheck, it can affect your ability even just to make rent. There's a chart on the second page of our testimony from Harvard's Shift Project showing the tremendous increase in homelessness that arises from when workers have unpredictable schedules. So what this bill does, it applies some basic core protections, 2 weeks notice of shift schedules, 1 extra hour of pay if workers' shifts are changed last minute, partial pay if shifts are canceled last minute, 1.5 times workers' regular weight when they work these what we call clopening shifts, when you close out at the end of one business day, maybe at 11 or midnight, and then have to start the next day at 5, 6 a.m. So just when you work those clopening shifts, a little bit extra pay, and a few other basic enforcement mechanisms. So with that in mind, we ask for a favorable report. Thank you so much.
David, your voice sounded great.
Thank you.
All right, and next is.
Good afternoon, Madam Chair and members of the Senate Finance Committee. My name is Helen Gim, and I am a former at-large member of the Philadelphia City Council and the sponsor of our city's ordinance on predictable scheduling, which passed in 2018. Contrary to what some people may think, predictable scheduling is actually about what happens to people when they are not working for their employer. Our studies showed that prior to the bill's passage, a vast majority of employers in Philadelphia required their workers to keep their schedules open and available. That meant that more than 80% of workers did not have regular daytime work schedules, and has been said earlier, almost half could not even predict their weekly income. Parents and caretakers testified about missing medical and prenatal appointments. Canceled shifts meant that people struggled to pay rent or cover childcare costs and grocery bills. Our intent was to protect people from abusive practices that contribute to instability and perpetuate poverty. So I crafted Philadelphia's predictable scheduling ordinance through months of roundtables and feedback sessions with our labor, business, and civic communities. Our law reflected lessons that were learned in other jurisdictions and addressed challenges raised by businesses. Here were our core components. First and foremost, we applied the law to large businesses, which includes franchises, which have the workforce management resources and the technological capacity to handle large-scale documentation and scheduling. Software companies do provide products that adapt to meet any scheduling compliance needs. And additionally, large corporations already operate under similar predictable scheduling laws in New York City and elsewhere. Second, we addressed challenges that had arisen in other cities to ease compliance and keep operations flexible and prevent abuse. Third, we staged the planned rollout of our Fair Workweek ordinance over 3 years. Today, predictable scheduling laws around the nation protect millions of working Americans and are now a workplace standard. I hope that the committee will consider a favorable report on this bill, and I am available for any further questions.
We have.
Good afternoon. My name is Laura Narafsky. I'm a senior counsel with the National Women's Law Center in Washington, D.C. And I want to thank the members of the committee for taking time to hear this bill. The Predictable Scheduling Act would help working women and families by improving job quality and promoting worker health. Unfortunately, workers across the country and here in Maryland continue to be plagued by unstable and unpredictable work schedules, as we've heard, which impose high costs on working people, families, and the broader economy. People working across the state, but disproportionately women and people of color, are working in essential but low-paying jobs and often receive little notice of their work schedules and experience last-minute cancellations. When women's jobs don't allow them to balance their responsibilities at work with their caregiving obligations, when they can't secure reliable childcare that allows them to go to work, when they can't rest or get medical treatment that they need to keep themselves and their families healthy, it is hard and sometimes impossible for women to get and keep good jobs. Yet that is exactly what many women in this state are facing. A 2022 study from the Harvard Business Review found that unstable schedules contribute to the gender wage gap, which is particularly wide for women of color and their families. Black mothers working full-time in Maryland make 56 cents and Latina moms make 41 cents compared to white non-Hispanic fathers. I think it's important to note that today, on Equal Pay Day, this committee can do something to help lower the gender wage gap. Predictable scheduling legislation like this can help. Similar laws are already on the books in major cities across the country, as you've heard, and they are working. What's more, these laws are good for businesses. Just-in-time scheduling practices that ignore workers' needs result in increased turnover and absenteeism, whereas more consistent hours and advance notice make it easier for employees to consistently be and stay at work. A pilot program from The Gap found that predictable scheduling led to higher productivity, increased sales, and improved manager satisfaction. Working families in Maryland deserve jobs that allow them and their families to thrive. This bill presents an opportunity for you to help them do just that. I request a favorable report. Thank you.
Good afternoon, Madam Vice Chair and members of the committee. My name is Zoe Gallagher, and I'm the Policy Associate at Economic Action Maryland, formerly the Maryland Consumer Rights Coalition. And I'm here to urge your favorable report on Senate Bill 944. Unpredictable scheduling can have a drastic impact on the mental health and personal life of workers, which is further exacerbated by the inconsistency in income. 3 in 4 hourly wage workers under 35 report that their hours fluctuate from week to week, which means that not only are their hours unpredictable, but their income is too. On top of that, fluctuation of hours often means that workers can lose access to social safety net programs like SNAP and TANF due to hourly work and income requirements. For example, to qualify for SNAP in Maryland, you need to work at least 20 hours every week with no averaging. So if an employer decides to cut hours for just 1 week without an employer's consent, they lose access to both wages and SNAP benefits. This is the case for many other social benefit programs that have income requirements, as an hourly worker's pay can fluctuate from week to week, bringing them just above the eligibility threshold 1 week and below it another. As a personal anecdote, both of my older brothers had experiences in which they were the only key holders left at their stores after a mass quitting. My brother Kevin was a part-time employee at Teavana at the Towson Mall who could only work 35 hours a week, so he was scheduled to come in and open, leave, and come back to close for 3 consecutive weeks as a student at Towson University. My brother Jonah missed Thanksgiving dinner 1 year because his employer needed him to come in last minute to close the store. Everyone should be allowed some semblance of work-life balance, or at least be compensated when that balance is uneven. Business practices like these allow multi-million-dollar companies to pinch pennies at the cost of employee mental health. The pandemic made it clear that workers keep our country running. They should be treated with respect and adequately compensated for their time and dedication to the companies they work for. For these reasons, I urge a favorable report.
Next is it must be Jasmine.
Hi, thank you, Madam Vice Chair, and members of the committee. My name is Jasmine Bonamolo. I began working when I was 16 years old, and up until 2022, I worked in retail. A lot of the times, my scheduling would be posted before I was scheduled to come in, or was frequently changed a day or two before. And as a student, I didn't have the ability to just, throw my school responsibilities out, which could often result in write-ups. One time, while working at a wonderfully known grocery store, Harris Teeter, I was scheduled for a specific time without being notified. And it was a morning shift, and I get a call and I was asked, "Where are you?" "I can't come in." "Well, we scheduled you." "That's not what I have on my schedule." I was somebody who took pictures of my schedule. I knew what my schedule was. And that's just when I was younger. After I had my son in 2022, it became harder because I had a newborn and my husband was the only source of income. And in going to interviews and going to find a job, I ran into the issue of not being able to know when I would be scheduled. They would say, "Oh, our schedule gets put out a week before." I don't have that ability. especially with newborns. Everybody, if you have kids, know that those newborn appointments back to back until a certain time. I had to frequently worry about when he could get diapers, formula, because this was also the formula shortage. So formula prices hiked up. Wipes and just basic things like that. So when it came to making sure my son was okay, I had to hope. And had I been able to get a job with predictable, I had to worry about what my son was going to get. I really hope that you find in favor of this bill because it could change the lives of people like me. Thank you.
Okay, do we have any questions from the committee? Seeing none, we'll take the next group of people. And don't go far just in case we need you, but you all sounded good. Thank you, Senator Benson. So Everett Hackett, Denise Dunham, Kayla Mock, and Christopher Meyer. And we'll start on this end and go that way again.
This way?
This way. Nope. So the closest one to, yeah, the closest one to the stand there.
Thank you, Vice Chair Klaus Meyer, members of the committee. My name is Christopher Meyer. I'm a research analyst at the Maryland Center on Economic Policy in support of Senate Bill 994, excuse me. We support this bill because it would offer basic protection to workers at the largest employers in the food service, retail, and hospitality industries. That's protection that these workers need to juggle multiple jobs, pursue their educational goals, or even arrange childcare. The witnesses who went before me and the other witnesses at this panel will tell you a lot about the benefits for workers. This bill is also good for Maryland's economy. As the members of this committee surely know, Maryland's labor force participation rate has struggled to get back to its pre-pandemic level, though it does remain above the nationwide average. The Comptroller's Office's State of the Economy report highlighted access to childcare as among the most important contributors to our failure to recover labor force participation. By enabling workers in these industries to have predictable schedules, that will enable them to arrange childcare. You simply can't schedule childcare if you don't know your own schedule. That's just one example of the way that this bill will strengthen Maryland's economy. I do want to be clear about what Senate Bill 994 does and what it does not do. Here's what it does. At the largest food service, hospitality, and retail employers, the bill protects workers from unilateral schedule changes by management. What it doesn't do, it explicitly exempts small and independent businesses, and it has no impact on workers' flexibility. It doesn't affect worker-initiated schedule changes or shift swaps, and it doesn't require compensation in those circumstances. So it's important to be clear that this bill benefits worker flexibility. For these reasons, I'm asking for a favorable report. Thank you.
Next.
Good afternoon, Madam Vice Chair. My name is Kayla Mock. I'm here on behalf of UFCW Local 400. We represent over 35,000 frontline and essential workers, many in retail, who work under similar or more restrictive collective bargaining agreements and around predictive scheduling that are presented here in this bill. So according to a Brookings report in August of 2023, 17% of the US labor force works on unpredictable or unstable hours, and those impacted are disproportionately concentrated in lower paid occupations in retail and service sector jobs. I also want to ground my next statements with this. Continuing to raise wages, which is incredibly important, without also addressing scheduling practices and access to stable hours is never going to have the full effect of creating sustainable jobs and with that a sustainable workforce. For example, if a worker makes $20 an hour but only gets 4 hours a week or 4 hours one week and 30 hours the next week, that is not a sustainable job. Wages and predictable schedules resulting in stable hours are intrinsically linked together. Workers end up in jobs that don't pay enough to live on and aren't predictable enough to plan a life around. Unpredictable schedules also means an employer has control over an employee's life even when they are not at work. Retail workers often talk about this feeling of being on call when they are off, meaning that they would have to pick up the phone and agree to come in when they weren't on the schedule because one, they need the hours, or two, they feel the fear around being retaliated against and their hours being cut if they say no. For all of these reasons and more, we urge a favorable report on this bill and hope to move forward.
Thank you very much.
Good afternoon, Vice Chair and members of the committee. My name is Everett Hackett, and I am the political coordinator for Unite Here Local 25, a union that represents 6,500 hospitality workers in Maryland, the District of Columbia, and Virginia. I am urging you to support the Maryland Predictable Scheduling Act. This act is very critical for our members and working class families, and it will provide necessary stability and predictability for our families across Maryland. This act will be integral for families struggling to maintain a work-life balance while raising the next generation of leaders in the state of Maryland. For hospitality workers, having access to the work schedule in advance is completely necessary for all elements of raising our children, whether it be coordinating childcare, scheduling doctor's appointments, facilitating school pickups, and maintaining household responsibilities. With the current status quo of unpredictable work schedules, families are struggling and dealing with additional stress, financial strain, and difficulty in providing the care that the children in Maryland need. The Predictable Scheduling Act will hold employers accountable to providing fair and consistent work schedules. Having 2 weeks notice gives workers the necessary opportunity to make plans for the necessary parts of life and give workers the opportunity to voice their adjustments when they need them. This legislation would be a lifeline for single parents who are working very hard to make ends meet to provide a better future for their families in the state. I implore you to consider the challenges that single parents, families in the workforce have and support this bill and help us secure a stable and more secure work environment. Thank you for your care and attention to this issue, and I am urging for a favorable report.
We have.
Good afternoon. My name is Denise Dunham. I'm a single mom of 3, with the youngest being 10. I'm currently employed at Giant Fruit. I've been there for 18 years now. I know for me and my family, it was very hard. You just didn't know what your schedule would be. It would change weekly. So it made it tough for me to be able to find childcare or to have a family member to be able to take care of my children while I was at work. I just know my previous employee, I was never home. My son basically raised my children because I was never home. I was always on a late shift. It was always 3 to 11. When I got home at midnight, they were asleep. When they woke up for school, I was too tired to get up. My son basically had to get them dressed and get them off to school. So when I only stayed at that job for a year and I left, and this is where I'm currently at Giant. And that schedule basically worked for me because it made me to a point to where I can be a parent, to where I can be the one to take care of them, make sure that they were dressed and fed and help them with their homework. So I can keep going on and on and on, but I'm just here just to support the bill, and hopefully you all will vote for it. Thank you.
Before I open it up to questions, I just have a question. That you worked at one place for a year?
Yes.
And you're currently working?
Yes.
And where are you working?
I work at Giant Food.
Oh, okay.
Yes, and I've been there for 18 years.
Okay, I thought you
Yes.
said 18
Mhm.
years. I was a little confused. So, do we have any other questions? Okay, Senator Washington?
Chair. I just wanted to say thank you for your 18 years at Giant. I know just what you're going through and would have been somebody I'd known for a long time had the same life as yours, where they had kids and the kids would raise the kids. And because you can't be two places at once. And having this type of, if you had this predictive schedule, what would have changed for you in your household?
I will basically say that, you know how your children, when you're not home, it's so different. I think they would, how can I put it? They would look up to me better, like, Mom, where were you? Like, you should have been here with us. So I just think it just would have been more of a respect matter, and just looking at me like, that's my mom. Like, she was here no matter what. That job, it came second. Right.
And so it made a real big impact on your family. And this could have changed the dynamics between your relationship between your family and you, and as a mom who want to raise their kids on a consistent. Absolutely. Thank you very much.
Thank you.
Thanks. Are there any other questions? If not, okay, we're finished with the proponents, and now we'll take the opponents. Kurt McCulley, Kelly Locklear, Amy Rover, James Stark, and Melvin Thompson. And thank you all very much for your testimony.
Good afternoon, Madam Vice Chair and honorable members of the committee. For the record, Kaylee Locklear here on behalf of the Maryland Retailers Alliance. We are in opposition to this legislation. The ability to schedule in response to weather, like snow, that's not an exemption in this bill. Employee issues or sickness, that's also not in this bill. Truck schedules, special promotional events, or public events really is essential when running a retail business. Many times, schedule changes are necessary, and by mandating that retailers cannot make needed changes without them in writing weeks in advance or incur a pay penalty will severely impact scheduling. This bill is also unnecessarily prescriptive. It mandates immediate notification from an employer in writing, and then acceptance in writing by the employee as well. It also mandates, and I quote, engagement in an interactive process. Very, very prescriptive there. That's obviously what happens when you have discussions, as well as record keeping standards for every single time that an employee has to switch or move a schedule around for 3 years. Employees, by the way, also have to then write to their employers anytime they want to change their schedules. All of that is found on page 6. The rigid scheduling requirements in this bill ignores employees who choose their jobs because of flexible scheduling. And it also ignores the differences in how businesses operate. The unique scheduling flexibility in retail jobs that our industry offers, in fact, helps people balance important priorities in their lives, like going to school, working another job, or raising a family. I'm glad to answer any questions. We do urge an unfavorable report. Thank you.
Okay, thank you. Kurt.
Madam Chair, members of the committee, name is Kurt McCauley. I work for WMDA Car. We represent service stations, convenience stores, and auto repair shops in Maryland. I understand what the people are saying that want the bill, but the facts are, I have members that have franchises, small franchises inside their C-stores that only have 10, 20 employees. A couple of them only have less than that, but average is about 10, 20 employees. They're not part of a large organization. They fly that franchise flag and they pay a advertising fee. But other than that, the franchise has nothing to do with their operation. But this bill drags them in there, casts that wide net. And the 11 hours paying overtime, that really makes a restrictive schedule, especially if someone wants to get in more hours, wants to get their 40 hours in quicker during the week and have a couple more days off. But it also says you have to pay someone time and a half for that, which is understandable if it goes over 40. But if an employee comes in late, someone has to cover for him for a half hour. You got to pay him time and a half for that half hour, or 4 hours of regular pay, whichever is higher. So an $18 an hour employee, instead of getting $13.50 for that half hour, will get $72. And the rest of mine is me too with Kaylee, and I know you all had a long day, so thank you.
Thank you. Amy?
Good afternoon, Madam Chair, members of the committee. My name is Amy Rohrer, here on behalf of the Maryland Hotel Lodging Association. Senate Bill 994 proposes a costly mandate on hotels, and it's coming at a time when we have increased wages and benefits and are offering more flexibility than ever to attract and retain talent in the midst of ongoing staffing shortages. And hospitality, by its nature, is unpredictable. And hotels, similar to hospitals, never close. The further out we schedule, the more it's going to change. There are a lot of circumstances outside of our control, such as weather, power outages, flight delays and cancellations that can cause dramatic fluctuations in occupancy and affect staffing across multiple hotel departments within a very short time frame. At full service hotels, banquets and events may also be scheduled or canceled with very little notice. A family planning a funeral may request a banquet within a matter of days. It's just one example of a last minute need that we do our best to accommodate, but we need flexibility to do so. I'd also like to point out that it's not a standard scheduling practice to schedule an employee for a night shift followed by a morning shift. But when it happens, it's typically because the employee has requested that to accommodate something such as taking an afternoon class or some other personal reason. We're also concerned by the administrative burden this would place on employers and the duplicative penalties through the commissioner and the court system. I've submitted written testimony outlining these concerns and more. And for the sake of time, we respectfully request an unfavorable report on this bill.
Okay, thank you. Melvin?
Thank you, Madam Vice Chair. Members of the committee, I'm Melvin Thompson. I represent the Restaurant Association of Maryland, and we're also strongly opposed to this bill because it's simply unworkable for our industry. The food service industry is subject to changes based on customer volume, and this bill requires predictable scheduling on an industry that is inherently unpredictable. We often have to respond to a decline in customer volume. We might have to cut hours or let some staff that was scheduled go. Restaurants simply can't afford to pay labor costs for employees when there's not enough customer sales revenue to cover that labor cost. These are the reasons we oppose this bill. On everything else, I will say me too. This is just not workable for our industry, and we strongly request an unfavorable report. Thank you very much.
Any questions? Now, I do have a question. How often, maybe Amy, you can tell me, or one of, yeah, I'll just do Amy. But so a person gets up and gets ready and goes to work and has to take two buses like Senator Benson said. Does that happen often that a person would get to work and then you say, oh, I don't need you today?
I didn't ask that specific question to members when we were going through this bill, but one of the comments that they made was that it's typically that they're calling employees in because all of a sudden the hotel is at 100% occupancy. And so that tends to be the scenario we're dealing with more often than it canceled. Not to say that that might not, that couldn't happen, but.
And so to have an employee like in a catering job, you're having a big party and you have a list of people, and well, I guess that's not, you're in the hotel business.
We do banquets.
Okay, so you have a banquet and you have, say, as you said, a funeral. Would whoever you were having a funeral banquet for, would they have a list of people that they could call and say, look, we're having this, so we're having this and this is all of a sudden and we need 12 people. So you call 12 people up. It's almost like a hospital when you have what was called PRN. We need you today. We didn't need you yesterday. We need you today.
It's not that employees are required to be on call, but when something happens, the way it was explained to me is that the hotel will start going through a list, making phone calls saying, we have this need. Are you able to cover it? Yes or no? If the answer is no, it's okay, thanks. On to the next person.
Sort of like a substitute teacher, because you never know when you're going to need them either. So I got my calls a couple times. So Senator Ellis.
Yeah, thank you, Madam Vice Chair, and thank you for your testimony. Same question that Senator Klossmeyer asked, but Mr. Thompson. In the restaurant industry, you mentioned in your testimony that, a restaurant might not have the volume that day, and where will the revenues come to pay employees? So under the scenario Senator Klossmeyer asked, in the restaurant industry, if you have full complement of staff and something happens, if there's a bad accident down the road and people can't get to the restaurant, will they typically send people home? Say, we thought we would have 80%, 90% capacity, but we only have 20%. Would they do that? Have that been ever done?
Sure, and thank you for the question, Senator. Our industry does respond to changes. There are some historical trends. For example, weekends are typically busy in our industry. If there is an unexpected weather event, that could change. And in that case, you wouldn't need as many employees as you had scheduled for. Conversely, sometimes it happens the opposite. You get a lot more customers than you thought you were going to get. And so you reach out and give people the opportunity to come in and work an extra shift. And a lot of them are quick to take that opportunity in our industry. In fact, that's why a lot of people work in our industry, because of that flexibility and the option to pick up shifts whenever you want.
Yeah, but the other part of that is like,
if you don't need them, you would cut that staff because you just don't have the customer revenue to pay for that cost. Yes, it works both ways. Certainly, Senator.
Appreciate it.
Thank you for the question.
Is James Stark here?
He wanted to be here, but is sick.
Oh my gosh, you should have had somebody come in for him.
I don't think he'll come back.
Yeah, and I don't mean that rudely or anything, but that's the kind of things that happen. I really feel like, we're all human and you never know what's going to happen. So, any other questions? Okay, James is sick. Okay, so we're done this panel. We have two virtuals. Thank you very much. We have Shiva Spangler. Okay. Thank you. You can begin.
Thank you, Vice Chair Klossmeyer and members of the Finance Committee for the opportunity to testify today in favor of Senate Bill 994. My name is Shiva Spangler. I'm a Harford County resident and a parent of a teen who has been negatively impacted by the just-in-time scheduling practices at his part-time job. My son obtained his first job last summer at a fast food chain restaurant. His schedule is released 1 week at a time, and to this day, he has yet to receive his schedule with more than 2 days' notice. More often than not, he's given his schedule on Saturday, providing less than 24-hour notice of when his shift begins on Sunday. My son is a cadet in the Civil Air Patrol. He has missed out on several trainings and orientation flights because he was not sure if he had to work. He's not comfortable calling off of work last minute, so he sacrificed his time outside of work to ensure availability. He has more concern and respect for his employer than they have for him. He has been asked to come in early and stay late, which he typically says yes because he feels obligated, sometimes working more hours than legally allowed. My son does not have any bills or family to care for, and yet he still feels pressure to assent to these unreasonable work conditions. These just-in-time practices impact a lot of workers, up to 60 to 70% of low-wage workers and teens. It also impacts teens. I can only imagine the struggles and difficult choices that the low-wage workers have to make. It is hard not to get emotional when you hear the testimony that's presented today and last week in the House.
And I also wanted to mention that the bill doesn't stop last minute banquets. It just compensates workers for the disruption in their life by giving them 1 more hour of pay. I would like to thank Senator Benson for supporting this issue, and I urge you to give SB 994 a favorable report. Thank you.
Viva, is there any questions? Okay, then next we're going to take Peter Fugel.
Thank you, Madam Vice
Thank you,
Chair and
Peter.
members of the Senate Finance Committee. My name is Peter Fugel, and I am a postdoctoral research fellow at the Rutgers School of Management and Labor Relations. I'm currently conducting a comparative study of scheduling regulation in 8 cities and states, including Seattle, Oregon, Philadelphia, and New York. The study was awarded funding by the National Science Foundation on the basis of its intellectual merit and broader social impacts at the Rutgers School of Management. I'm testifying in favor of the Maryland Predictable Scheduling Act. My written testimony includes references to a handful of the growing number of studies documenting the harms of unpredictability and the benefits of predictable scheduling policies such as the one before you. Today, I want to highlight one of the most relevant studies by Kristen Harknett, Danny Schneider, and their Shift Project colleagues, who surveyed workers at large retail and restaurant chains before and after Seattle's secure scheduling ordinance took effect in 2017. Their results, published in the Proceedings of the National Academies of Sciences, show the Seattle ordinance improved schedule predictability. In the first 2 years, the share of workers who received their schedule 2 weeks in advance increased by 11 percentage points. More predictable scheduling resulted in better sleep quality and fewer economic hardships for workers and their households, including less food insecurity, housing instability, or difficulty paying bills. If you follow the example of Seattle and the dozen other jurisdictions that have successfully implemented predictable scheduling laws, reasonable to expect similar improvements in the well-being and economic security of retail, food service, and hospitality workers in the state of Maryland. Be happy to answer any questions you have about this or other studies, including the stable scheduling study referenced earlier in partnership with the GAP, which I worked on with Susan Lambert. Thank you.
Tracy Lingo. Okay.
Good afternoon, Chairman Beadle and members of the Senate Finance Committee. My name is Tracy Lingo. I'm the president of Unite Here Local 7. Our union represents over 2,000 workers who work in hotels, university food service, casinos, event centers, and stadiums throughout Maryland. Hospitality workers, including our members, often have unpredictable schedules, as you've heard today. Many don't know what hours or days they'll be working, even until days before a new pay period begins. This affects our members. They have trouble finding childcare or planning other necessary activities like doctor's appointments because they don't know when they'll be working. And it also makes it very hard to plan your budget. Even things as simple as trying to figure out transportation to and from work when our members often have to share one car for a whole household of workers. It makes it very, very difficult when your schedule is so unpredictable. I think one thing that also doesn't get touched on enough is that when low-wage workers have to juggle multiple jobs to be able to survive, unpredictable scheduling sometimes makes that almost impossible to do. Actually, another one of our members, Carolyn Easley Brooks, who's a worker at Fanatics, had thought she had signed up and is waiting to testify today. But, you know, if you get to hear her story, she works at the team store at Camden Yards, and for many, many years through several different union contractors had a predictable Monday through Friday schedule that coincided with the team store hours. The new company, Fanatics, took over that, who you may know from their production of jerseys, took over operating the retail store at Camden Yards, a contract with the Orioles last year, and decided to move to a just-in-time scheduling model. That means that Carolyn often doesn't know when she's working. And they've split up her schedule. Instead of being a 5-day-a-week schedule, some days she works 3 days and some days she works 2 days because they insist that their business model doesn't include full-time work. For Carolyn, that's meant that she has had to take up a job at the convention center where she has the same type of problem. I also just want to say, in terms of the banquet scheduling, we know banquets very, very well. And one thing that people should understand is that companies often do know when banquets are scheduled fairly far in advance, but sometimes wait and make those schedules to the last minute to sort of optimize their own flexibility. And so I don't think this bill really would inhibit that. And as others have pointed out, it really just occurs.
All right. Can you wrap it
Thank
up?
you. Yes,
Okay,
thank you.
Thank you. Thank you very much. And any questions? All right, thank you very much. And that, I think you are our last person for the day. And we will get ready for voting.